healthy tips. I appreciate the questions I've gotten this week about sleep because sleep fits with our theme quite perfectly. If you've been following these healthy tips, you know that we started talking about prevention and how important prevention is and how it could really be a great theme for 2022. And then as part of working on prevention, we've talked about capacity and how, especially in these crazy times with all the uncertainty, building capacity can be key to maintaining your health. So let me explain more of what I'm talking about. Have you ever gotten to that point where you feel like you could cry for kind of no reason at the drop of a hat? Or have you felt like you can't handle one more thing? You've had it. You are full. You can't handle anymore. Well, those are signs that we need to work on capacity. The capacity is kind of used up at this point. And that is the kind of thing that actually puts you at risk for a number of different kinds of health issues. And one of those is related to your sleep. So there is a very close tie between anxiety, things that make you anxious and how you handle that stress and anxiety, and how you perceive pain. When you're anxious, you tend to, pain feels worse, and pain's subjective. That's why they give us that scale from 0 being no pain and 10 being the worst pain you can imagine. Well, something that's not a big deal and maybe is a 3 typically, when you're feeling anxious and overwhelmed, that same pain can feel like an 8. And then the other key part of that triad is your sleep. Have you noticed when you don't get enough sleep, things stress you out so much easier? Your anxiety level is higher. And when you don't sleep well, pain feels worse. I see that with my patients all the time. When they're more anxious, pain feels worse. And when they're not sleeping well, pain feels worse. When they're not sleeping well, their anxiety levels are much higher. So how do we break that vicious cycle? Well, I have found with my patients over the years, the spot in that cycle that's sometimes the easiest to stop the cycle is to enhance the sleep. So we'll just talk about a few tips here. I'll be sending out some information in writing if you follow my posts with more tips. But the first one is you want to emphasize sleep in your life. You want to give it a priority. So that partly means that as sleep time is approaching, that you shut things down, get away from screens, get away from anxiety. For a lot of people, watching news right before bed is not a good option, but rather do things that relax you, whether that's related to music or scents or nice, gentle stretching or massage if you've got a partner or somebody in the house that would help you with that, or those things that quiet your mind. We've talked before about breathing. I mean, we take breathing for granted. We don't even think about it all day long. But when we stop to control our breathing, that actually occupies our mind and is a great calming effect. So there are a number of strategies, but just deeply breathing in and slowly breathing out. For a lot of people, that has helped if they are thinking in their head through a favorite quote or verse that has meaning, a lyric of a song, something that will add to the relaxation factor, trying to clear your mind. And then there are a number of sounds you can play on your phone or play otherwise that can actually help you sleep because it blocks out distraction and it can quiet your mind. If there's just a lot of stuff going on in there and you're going through your to-do lists, that can help. And so I want you to go in and look up on the internet, white noise, pink noise, brown noise, nature noises, ocean noises, rain noises. See which one relaxes you the most and think about having that going. Now, I just mentioned get rid of the screens, get the phone out of the room, but If you quiet it so that you don't get disturbed by texts and phone calls and that kind of thing, and it's only playing the noise that relaxes you and then the alarm that goes off in the morning, those are some tips to get you started. You don't have to do them all at once, but think about one or two that you can use to try to enhance your sleep quality. And I'll wrap up saying, I'm Dr. Michelle Fritsch. I'm a geriatric specialist pharmacist, and I do not recommend medication to help you sleep. When you have medication or alcohol or marijuana or other substances that you think are going to help you sleep, the type of sleep you get is not the same. You don't get that deep sleep, the kind that really makes you feel rested, the kind that helps you manage that anxiety and helps you manage that pain. You don't get that same type of sleep when there's a substance involved. So I encourage you to try hard to sleep using these other techniques and not medications. Send me your questions. I love talking about these topics. I will gladly approach it again, and I can bring back some more tips. I hope you have a great day.